Good morning, everyone. Still see some folks are hopping in, but welcome to the October 2023 ConnectOC Coalition meeting. For those of you who have not been here before, ConnectOC is a coalition here in Orange County, California, focused on promoting existing mental health resources to 16 to 24-year-olds. We're funded through the Mental Health Services Act by the Orange County Health Care Agency. We're excited to have you all join us. What we'll do here is get started in just a couple minutes. We like to give folks a couple minutes to hop on. But if you would, in the interim, you would introduce yourself in the chat, your name, if you're with a particular organization. If you would like folks to be able to contact you outside of the meeting, feel free to include your contact information. But we'd love to see who's here in the meeting and get the interaction going. I'm excited for today's topic and to introduce our speaker to you in just a bit, but we'll give it a couple minutes and we'll jump back in. Okay, well, good morning again, everyone. For those who are already here, thank you again for joining us and for putting your information in the chat. For those who are just joining us, welcome. So this is the October 2023 meeting of the ConnectOC Coalition. We're happy to have you all join us. So ConnectOC is a program of Partners for Wellness. We're funded by the Orange County Health Care Agency through the Mental Health Services Act. And we're funded specifically to promote existing mental health resources to 16 to 24-year-olds here in Orange County. So with that in mind, each month our meeting, we try to focus on a particular theme or area of programming or service available here in the county to better educate the community, better educate TAE and those who care for them, as well as those who serve them about the resources that are available. So for those who joined us last month, and if you didn't, you can see our meeting from last month at our website, connect-oc.org. Go to Coalition Meetings, and you'll see the videos from previous meetings. But last month, we focused on step up and step down services along the continuum of care. So things like intensive outpatient programs or partial hospitalization programs or crisis residential programs. Thinking about those services that support those who are at some level of crisis, but maybe not at an acute crisis, we're looking at the ways in which we continue to reach those people who are experiencing various levels of crisis. And so this month, we're focusing on mobile crisis response and the continuum of care as a whole. And as a part of that, we're featuring, we're happy to have as our speaker, Matthew Key, who's with the Orange County Health Care Agency. We're talking about the CAT team, the crisis assessment team, and other services there. So Matthew, if you would mind introducing yourself, and then we'll dive in.
Yeah, thank you for that welcome. Good morning, everyone. So I'm Matthew Key. I am a health services manager with our crisis and acute care division at the Orange County Health Care Agency. For those of you that know, this some of you may know, some of you may not know, we recently went through a reorganization at the healthcare agency. Prior, we had just a few divisions. We had a division for children and youth, and a division for adult. We had our quality management division. Now we have 7 divisions currently, and we created this new division called Crisis and Acute Care to solely focus on our crisis services. So we merged our children's services along with our adult crisis services under one division, so we could have more depth and understanding into that area. I actually came from our children's side of our shop in that reorg, so my areas of experience recently have been related to our children and youth and our TAE population, specifically our crisis services and our more intensive outpatient services, which included our children and TAE full service partnership programs as well. And I've been with the county for about 10 years, and I'm an LMFT. So nice to meet you all. Nice to see some faces looking back. I appreciate it. Should I just?
Yeah.
Do you want me to just jump into it, or?
Yeah, why don't we go ahead and then have you jump in. So Matthew's going to begin with a bit of a presentation about the continuum of care and some of the services over at the healthcare agency, and then we'll dive into a bit of a discussion. And as we're engaged in our discussion, I want to invite everybody to share any questions you have in the chat, and we'll incorporate those in the discussion. But Matthew will start us off with the presentation.
Yeah. As David's saying, please feel free to ask any questions, put them in the chat, and don't hesitate to interrupt me, David, if you need to. Better to get it while we're in the context instead of trying to circle back and remember what we were talking about. So, okay. So as I said, I'm with the Crisis and Acute Care Division, and so within our division, we have a few different program areas. We have our OC Links program, which hopefully you've all heard or seen about in some capacity, which is our 24/7, 365 behavioral health line. And so they provide a lot of support for our crisis system, as well as the entire system of Orange County as a whole. And I'll get into a little bit more about how that impacts CAT in a minute. Also in our area is our adult and children's crisis programs, our crisis residentials, our crisis stabilization units, and our in-home crisis programs. We also have our inpatient services in crisis and acute care. So our contracts with our hospitals in Orange County for inpatient hospitalizations for children, adults, TAE, the whole gambit, and our CSUs. And so that's kind of our service area as a whole. Let's see, how do I make this thing go forward? Oops, too far. Sorry, a little delay here. Okay, so just to give a basic overview of our continuum of care and the services provided within Orange County, this is kind of just a nice little visual in terms of what resources there are available. There's prevention services. We have our navigation, access, and linkage services, which include OC Links, as well as our access line. We have our crisis services, inpatient, and then our outpatient services, which range from outpatient clinic level of care, full service partnership services. And then we have our SUD services, our recovery support services, residential treatment, and homeless housing services. So, but today we'll be focusing on these two teal colors mostly, which is our navigation and then our crisis services, and kind of how that works together with our crisis assessment team. Okay, so we'll start off with CAT. So our crisis assessment team, we provide mobile crisis response to any individual, any age in Orange County that is reporting a behavioral health crisis. So if they're experiencing some sort of behavioral health crisis event, we respond to those individuals. So we provide crisis evaluation and risk assessment, crisis intervention, and then when needed, we do the 5150 or 5585 civil commitment, so which is hospitalization. So our goal is never to hospitalize individuals. Our goal is always to try to get them to a lower level of care if possible, but there are times where that hospitalization process is needed to stabilize them from their current crisis event. We accept referrals from anyone. Doesn't have to be in Orange County. It could be a loved one out of the county, but our primary referral sources tend to come from our families or private individuals in the community, the law enforcement within Orange County, SSA, and then our schools are also a very large contributor for our TAE and children populations for calls for evaluation as well. And as I mentioned, we respond anywhere within the bounds of Orange County, including unincorporated areas. There are a few areas where we don't respond, which are like hospital emergency departments, hospital floors, things like that, because the hospitals are responsible for that care on their campus, as well as in correctional facilities. We're not doing holds in jail, as the correctional mental health staff are the ones that are providing that service there. Okay. Okay, so what are our services and kind of how do we do that? So we provide mobile responses to individuals reporting a behavioral health crisis. So our teams, we are located in the Orange area is where our main office is, but we respond to anywhere. And so they're out driving around all day long, getting out there to wherever that crisis event is happening to support that individual. That could be from a park bench to a school classroom to the beach, wherever it might be. We also try to spend a lot of time providing education to the clients, families, and loved ones. So a lot of times, as our goal is not to hospitalize if we can avoid it, a lot of our services involve educating the family on what they can do to support, and the resources and other supports in the community for that individual. We're always providing ongoing and continuing training and education to majority of the time it's for our law enforcement partners or schools and school districts, but we're always providing community events and try to be a part of panels and other conversations and providing presentations. So if anyone wants more detail from what I'm going over today, then more than happy to reach out and we can schedule other presentations and provide more support depending on who you'd like us to present to. So we definitely want to make sure that everybody has as much information as possible.
Matthew,
yeah.
Quick question on that. So the training and education that you provide to schools and school districts, can you elaborate on that? Maybe give some examples of the kinds of training that you offer?
Absolutely. So our focus is obviously on what to do in that crisis event. But a great example is most recently we just had a presentation that we collaborated with the Santa Ana Police School Department, the MHSSA's regional coordinators. I don't know if people are familiar with them, and then so they invited a bunch of the school districts and schools, and so we kind of presented. We like to educate on what is our process, what we're looking for when we're going out and evaluating youth. That was more focused on children, but and kind of what are the laws, the regulations, what it means when we are putting somebody on a 5585 compared to them going and receiving voluntary treatment, and helping answer any questions and dispel any myths around what our services kind of entail and where we try to link them to. Obviously, we always have challenges between HIPAA and I always forget this one. Is it PERSA that the schools have, which is their privacy thing, and so there's certain things we can share and certain things we can't, so kind of helping people understand some of those communication challenges that might arise or not being able to get that information across, even though we would like to in certain circumstances. So
yeah, that's great. That's helpful. Thank you.
Yeah. And so if we're not hospitalizing, we tend to refer and link to 3 main locations, which are our crisis stabilization units, our crisis residential programs, as well as our in-home crisis stabilization program. Typically, if somebody's called us, the individual is experiencing a crisis event and they're needing more help and assistance, but they might not need a hospitalization stay. And so how can we get them within our system to really start getting them the support that they need so that they can maintain that path of recovery and kind of get back to a baseline or a norm for them. And I think as everyone here probably is acutely aware, is our TAE population is very challenging to engage, and it takes a lot of efforts to get them to agree to treatment. So we try to really help them find what's going to fit in their needs when we're linking them to ongoing services, but also ensuring their safety, right? Which if they're not agreeing to certain things and we have concerns, we do hospitalize, and it is that involuntary hospitalization. Did you have another question, David? It looked like you unmuted on my screen.
No, yeah, you're
okay.
good.
All right. And then we also provide case management follow-up, right? Because we don't want to just have a client go out there and we say, here's a piece of paper, here's a phone number, good luck, talk to somebody. Our goal is to really make sure that they're getting linked because as back when I was doing individual therapy, I would always tell clients like, hey, it's great to see you. It's nice to meet you. I never want to see you again. That's my goal because I want you to be doing well and not to need me for your support. So we really want to make sure we get that follow-up in, and we don't want to see people in crisis. We want them to feel better, but we're here if they need us. So we do offer that case management follow-up to try to link them to those ongoing services that are going to be a good fit for them and to help them navigate the system. We recognize that the Orange County behavioral health system is robust, which is great and wonderful. And we're really proud of all the work that's done in our system. But we also recognize that it can be difficult for people to know where to go or who to ask for help and find that place that's going to be the best fit for them. All right. So within CAT, we also have our CAT PERT collaborations. So this is where we have a clinician that rides along with an assigned law enforcement officer who has a level of behavioral health training. And so they respond to calls together to help address some of those calls that are coming into the police department. So these are typically the calls that come into our OC Links line, but they are the calls that are going to the different areas, different law enforcement agencies. So we can address that. And so they partner really well with our clinicians, these law enforcement agents or officers, and they work to help in tandem to address those behavioral health emergencies that law enforcement sometimes is responding to as well, or the call is needed for. These are regional responses. There's also a follow-up component of that, and typically the officers are dressed down. So I know the officer in this photo is not, but a lot of times the officers are, in street clothes. So it's trying to present that less intimidating atmosphere to really support the needs of the individual in crisis, right? Because we don't want you to feel criminalized because you're having a behavioral health crisis, and our partners understand that as well and want to try to help with that process also. So these are the following the cities that we have those current partnerships in, just for your knowledge that these do not operate 24/7. The crisis assessment team does operate 24/7, but each department has a different schedule with a clinician assigned to collaborate with their PERT officer.
Matthew, if you wouldn't mind, so we think about the collaboration that you all are doing with law enforcement. This is a really important collaboration. It's certainly one of popular conversation, the last few years. There's been a lot of conversation around bringing in other resources in addition to law enforcement to provide support in the cases of behavioral health crises. Can you maybe talk a little bit about from the experience of your colleagues in the program, why is a program in partnership with law enforcement like this important? Why some folks may still wonder, why not just send out law enforcement? That's kind of their job to go out when they're first responders, that kind of thing. Why is this kind of partnership so important?
This partnership is really important for a few reasons. One is, a lot of calls, not a lot of calls, but we do have calls where there are safety concerns, where somebody who has the ability to address that safety concern, whatever it may be, if somebody's physically aggressive, if there's a concern about weapons in the home, things like that, where they can kind of clear the scene and provide a level of safety to that response. And, because we really are the lead for that crisis evaluation and assessment. Our teams get a lot of training and support in terms of that. That's our job day in and day out. So our teams really are experts in what they do and determining level of care placement and helping to ameliorate that crisis event. And so, but having that safety net is definitely important. And then we also find on the law enforcement side that sometimes they get out to calls and they're not something that's really a law enforcement issue. So having that clinician available to be with them allows that flexibility, right? So one can take the lead or the other can take the lead depending on the nature of the call or how the call shifts in the process of that interaction between the team and the community member or the family members or whomever might be on scene in that location.
That's great. That's helpful. Thank you.
Yeah. And I also have some more information on some upcoming changes as well that I'll get to in just a little bit too, that'll also talk a little bit more about how we're looking to shift our model a little bit within the system. So how do you contact the crisis assessment team? So when we stood up almost 2 years now, the OC Links 24/7, 365 behavioral health line. Historically, OC Links was a Monday through Friday line, and then they expanded to including Saturdays as well. But about a year and a half ago, maybe a little bit more, we expanded it to 24/7. We shifted our dispatching of our crisis assessment team to our OC Links team. So they took over that component. So now anybody calling in, even if they're not in crisis, is getting a dispatcher who's familiar with that and asking those questions to hopefully help link them to or dispatch our CAT team if there's a need that's been determined based on that call, instead of getting redirected, right? And so trying to eliminate that wrong door, we want to have that no wrong door open policy to really get people in and get them directly to the services that they need. So before I jump into kind of some of the continuum of care items and the lower level of care options we have and expand on that, recently the state released a mobile benefit requirement. So within Orange County, our crisis assessment team has responded as individuals outside of our PERT team. So it's just been one person that's been going out on calls, which sometimes does require us to call law enforcement and utilize more support. But there's a new mobile crisis benefit that is set to go into effect at the end of this year, starting December 31st, where we are going to be responding in teams of 2. One of those people is going to be a clinician. The other position can be someone from another classification, such as a nurse, SUD counselors, parent partners, peers. It could be a psychiatrist too, but we can't, any of you know how hard it is to hire psychiatry. That's probably not going to be a part of our team makeup, but we really are looking to augment those services with peers, parent partners, to really help the support system as well when we're out responding to that individual in crisis. With that expansion is also going to come vehicles for our crisis assessment team. Currently, people are using, their own individual vehicles to reach locations, and we're transporting clients to levels of care through ambulance providers, through EMS, sometimes law enforcement if that's required, or other means. But with our expansion, we will have the option to utilize those vehicles to transport clients to their next level of care if it's urgent and needs to be done immediately if it is a safe environment. So with that, those teams are also going to have someone who is Narcan trained and able to administer Narcan as well. We'll also be addressing SUD concerns as well if there's calls for that. And it's similar to what we've been doing, but it's definitely adding a level of extra support for our team in that we are going to have 2 individuals to be able to support. And we know with youth, we know with the TAY population, sometimes there's some delicate relationships with the family members, and really trying to have 2 people to help manage those situations is going to be very beneficial in that response, not only for the client, but for the family members or the school or whoever else might be on scene when that individual is experiencing that crisis event. And we'll probably have to come back and visit you all again when we do another, when we get that up and running to get more into the weeds on it.
We would love to have you back.
Looks like there was a question in the chat. Yes, Stacy, you're absolutely correct. So EMS has been a challenge, especially through the years of COVID, in terms of some delays in getting that transportation. So that is part of the goal with this, is to really decrease those delays as well. So if somebody is not in the need of restraints for transportation and is agreeable to it, and we have the option to do that, since we are on scene, it decreases that wait time. We don't have to wait for EMS to show up. We don't have to wait for that process, and it allows us to get them and move them on to the next call. So absolutely. Okay. So I'll just move on through kind of what our crisis care our system of care looks like as we're evaluating clients, but determining, okay, they might not need that full hospitalization, and kind of some of those main resources that we refer to. The first would be our crisis stabilization units. So our CSUs are 24/7 programming. They offer crisis stabilization for somebody with a behavioral health crisis. the length of stay for this service is under 24 hours. So it's a very short-term stabilization process with the goal to link to ongoing aftercare supports. Individuals that can go to these locations can either be voluntary or they can be on a hold. So if they do need that, and the evaluation kind of determines, hey, this individual doesn't really need, is not looking like they're going to need 72 hours or up or more than that 24-hour period, they could probably stabilize in a shorter period of time. That's always our goal, and then get them linked to that lower level of care. With that being said, the CSUs are designated, so they do have the ability to write a 5150 or a 5585 to link that client to inpatient hospitalization and that higher level of care and longer term care if it is needed. So it's just a way for us to help kind of see, can we get them stabilized or not, and then move them to the appropriate level of care. And so same as with our CAT team, they serve all Orange County residents. So regardless of funding source, we're experiencing behavioral health crisis. So it's really open to anyone. As I already mentioned, they can be voluntary or involuntary. And then we have our units that we have one unit currently for 13 to 17 years of age at the BWell campus. And then we also have units for 18 and older. There's one at the BWell campus. We have one at College Hospital. And then we have our county CSU as well. So these locations all utilize recliners, and they're to kind of have space for everyone, and they're located throughout Orange County. We always try to place people, whether it's at a CSU or if it's at an inpatient unit, as close to their home as possible, because we do know that a lot of times with our youth and our TAs, their family, is still involved and want to be a part of that conversation to minimize the barriers for those family members to get in contact or be there as a support as well. So other crisis resources within our program, a little less acute, would be our crisis residential programs. So our crisis residential programs, they're kind of short-term stabilization programs where the individual will reside for a period of time, and it's typically up to approximately 3 weeks that they can stay there. It depends on kind of how they're doing in their treatment and their recovery. We definitely don't hang on to them for 3 weeks if they've stabilized and are ready to move on, but they do have the ability to do that if they're continuing to have those challenges, because our goal is to get them back into the community, get them back into their natural supports as quickly as possible. The CRPs are really run as a safe, monitored, structured home-like environment. We want them to feel comfortable there. And a lot of times it provides a nice respite for the client, but also sometimes the family as well, for our TAs and our children. This is just a basic rundown of kind of the services that are offered. So they're providing that crisis intervention, including the emotional support, de-escalation, crisis situations, temporary respite. They're developing a service recovery plan, so care planning, but it's more to address whatever that immediate crisis event was. They're not trying to get into, old childhood trauma, things like that. We'll leave that up to all you all out there and the other care providers within our system to kind of address the larger ongoing issues for individuals. For children and TAs, there's a lot of education there, not only around what's going on for their crisis event and substance use and things like that, but also assisting with interaction with the school districts, ensuring they're not falling behind if they're still in school. They have computers and time set aside in their daily programming to really support the educational needs of individuals, to help get them back or help them not fall behind in the other things that might be contributing to the stressors that led to that crisis event. They're receiving individual counseling. There's also family counseling available. And they don't administer medications at the CRPs, but they do hold the medication and help provide reminders and coaching to help individuals take their medication, whatever they may be on. They do have psychiatry on site though, so if there's a med change needed, an evaluation needed, they're able to provide that service. Also include peer support services as well. That lived experience is always very helpful for individuals. And then transition planning to really help ensure a smooth return to the community. That always starts on day one. The goal is to figure out what services have you been in, what services haven't you been in, and get them moved forward in that.
Matthew, quick clarification. What was the length of stay?
So it's It's up to 21 days, depending on our programs. It does vary. I know our TCRP, which is 18 to 26 years of age, our average length of stay there has been about 7 to 9 days. And then in our adult CRPs, it's closer to that 20-day mark, I believe, 18, 19, 20. Our children's CRP is running around 10 days. So they can stay up to 21, and if extensions are needed, there are the possibility of that for a few days or a week at a time. But it's not designed as a, as a long-term residential facility. It's really that short-term crisis service. So, and just, I don't think I mentioned it, but these are voluntary services. So we're not going hands-on, we're not restraining people, we're not locking them in and not letting them out. So it is these are voluntary programs within the county. Okay, so for our crisis residentials, this is just a quick breakdown of what's available within Orange County that we contract through, that contracts with us here at the Orange County Healthcare Agency. So we have 15 beds at our Coastal Star, Exodus CRP has 15 beds. Our Treehouse North, which is the older adult crisis residential, is 6 beds. They have the Treehouse South, which is 6 beds. Our Waymakers Tay CRP, which is more in line with this conversation, is 6 beds. And then our Waymakers, we have 3 locations of 6, 6, and 4 beds for the children. And that's 12 and up. We do not currently have anything for youth under the age of 12 within Orange County. And then, as you can see here, that our adult crisis residential serve 18 plus, so they do touch that Tay population if they're if the Waymakers Tay specific CRP is full. So we want to just ensure that we're still able to serve them. Even, our goal is always to get our Tays into our Tay CRP because it's designed for that developmental population and really to target that. But we obviously want to be able to serve people in other areas if for some reason they're full and not able to receive that support. Okay. And then the last service area I'll touch base on just a little bit today is our in-home crisis stabilization. It's a similar model to our crisis residential. The target length of stay is 21 days, so a 3-week program. But this is for clients that might have a secure or safe home environment or location, or sometimes people just don't want to go to a residential program. So they will go out and find them wherever they may be living or engaging with them out at those locations. Typically, the referrals come from either like emergency departments or our crisis assessment team. Sometimes they're step downs from CSUs as well out to this level of care. But ultimately, it's really that crisis event is the triggering criteria to say, okay, in-home crisis is needed. There was some level of crisis. They need some enhanced stabilization, and we're there to support that. So it ranges. The children's in-home crisis program is typically 5 to 17. They can serve younger, but we tend not to see those that are much younger than that in that program. And the adult population is 18 up. So touched on some of those. So the service model, like I said, is a 21-day program. That first week is really trying to build the rapport with the client's family, get them enrolled in the program. Also start the discussion on discharge planning and the next steps for the individual. And then they kind of move into the second week of treatment, which is really focusing intensive services for the client and the family to provide stabilization. And then the third week is really trying to get that transition and that discharge fully secure. So not only making the appointment, but making sure that the individual is showing up. And just like with the crisis residential programs, there are options for extensions. There's many times where we might have someone in this program for 4, 5, or 6 weeks, just because we want to ensure that they're getting linked to that next level of care and getting linked up and supported before they're on their way. We don't want to just abandon them and leave them without those supports in place. So services typically include crisis intervention, peer mentor, therapy services, the collateral family services, case management services. This is a 24/7 operating program. So they do immediate responses for our CAT team. So if we did an evaluation on someone at 1 a.m. and they didn't need hospitalization, but they have a safe place to be, but they need more supports, they'll come out at 1 a.m. They'll meet with the client, the family, the the clinician to really do that warm handoff and get them linked up with this service. So we don't want them to fall through the cracks and say, oh, here's your appointment in 2 weeks, good luck. And so that's one of the programs we've developed to really help ensure that we're not losing people or they're not falling off, especially with our TAY population and the challenges to engage. If we lose them, we might not get back in touch with them. So we want to really try to make sure we can grab them when we can. Okay. Oops. That's it. Yeah.
Well, that's great, Matthew. Thank you. Want to open up now to we've got some, as usual, some discussion questions, but for our attendees, any questions you all have, feel free, one, to put them in the chat if that's helpful, or feel free also to raise your hand. If you go down to, I'm sure most of you figured out by now what it looks like to raise your hand, but if you select reactions at the bottom of your Zoom screen, there's an option to raise your hand. Or honestly, feel free to just unmute yourself and ask a question if you have any questions. But a couple questions that come up for me, Matthew, meanwhile, are, I know that there was, you mentioned during accessing the CAT team, there's a couple considerations, a couple places that they don't go into hospitals. Hospitals have what they need to be able to take care of those who are in their care. Same thing with the prison population or the jail population. You mentioned that one of the best ways to access the CAT team now is through OC links. I know that when I first started seeing clients, the first thing I did was put the CAT team number, the direct number, in my phone, just in case I ever had a client who was in more acute crisis, than what I could support them with. And so is that still, so when we talk about, the question I'm getting to is, we talk about clinicians interacting with the CAT team or seeking additional support from the CAT team and other acute services with the county. What's the best way for them to interact with you all? Is the best way for them to reach out through the OC Links line? Is the direct line still a good resource? And in general, when you have a clinician giving you all a call, what are some things that would be helpful from them? What is it that when's a helpful time for them to call you? Does that make sense?
Yeah, absolutely. So the first part of that is when we switched over to the OC Links line, we've really switched to OC Links being that face of crisis. So if you need a crisis response, please call the OC Links number and reach out through OC Links. If you end up using the Navigator, which is the web self access portal, there's also a button on the upper right you can click as well that'll get you in touch with one of the navigators, which are part of the OC Links team, to ensure that they get that. So you can have someone to talk to in lifetime if something changes as you're going through that process. The old CAT number that we had is still active, but we're not encouraging people to use that, but we haven't gotten rid of it because we didn't want to lose people that had that number saved in their phone, like you, David. So that does just dump directly into our OC Links line. So that call will go straight to an OC Links navigator who is a clinician level staff who is trained to deal with the crisis response and ask the appropriate questions to help get them to that level of care. And we're more than happy to, if somebody has a question and they're not sure about a case and need some guidance and some support, you can call that OC Links and just say, hey, I'd like to talk to someone on the crisis assessment team. I'm unsure of if I need an evaluation or not. And they'll just link that call up if they're not able to specifically answer any of the questions that are being asked. But that's why the OC Links line is there, to help either answer those questions if it's within their scope, or pass it along to an individual who will be there. And like I said, we're there 24/7, 365, so you'll get to somebody very quickly.
It's fantastic. One, I'm loving the way that in this kind of restructuring that it creates more room for a kind of consultation opportunity. I know that maybe less so as a clinician, but certainly as a community member, sometimes calling someone like a CAT team, can feel like an extreme move. And there's always that kind of question back and forth. Sometimes we run into this when it comes around to calling 911, am I overreacting? Am I underreacting? When's the right time to call? So now we have the opportunity, and I think it may be a good encouragement for the public. You can call OC Links, talk to a clinician level staff there, help they'll help you walk through the scenario and get you directed to the right level of support that you need. Is that right?
Yeah, absolutely. You know, and if it's not needed, given what's going on, they'll make sure to link with other levels of service or care and really get those things going for you. And I think, you know, that's one of the things that we've been looking at is how do we do a better job of kind of educating the community and providers and the people that collaborate with us how our system is working and what we're doing within crisis. So part of our mobile crisis benefit implementation is we did receive a grant to help augment services and supports within our system, and part of that is we're going to be doing a campaign through Pulsar Advertising, and they're helping us because we're behavioral health. We're not the experts in doing marketing. At least I'm not. And they're going to really help us get the word out in a way that's palatable, and to also reach those populations that might not have as easy time accessing some of the other resources available. All our threshold languages. You'll start seeing us at the gas, at the gas pump, the screens that yell at you while you're trying to just get gas in your car. Hopefully we can get them to turn the volume down a little bit so we're not yelling at you too much. But really trying to get the word out there. And so we'll start seeing that hopefully next year, next calendar year sometime is when that's going. But we're in the planning phases of that.
Great. Quick follow-up, Matthew, and then I have Stacy, and I also have a question from Michelle in the chat. But Matthew, just to clarify, the threshold languages. So for those who don't know, English, Spanish, Korean, Vietnamese, Farsi, Arabic, and Mandarin, if I'm not mistaken. Is that right?
That's correct.
Okay, great. Stacy, I saw your hand, and then we'll come. Michelle, we've got your question in the chat. We'll come around to that as well.
You guys hear me okay?
Yes.
Yeah.
I had a problem yesterday. All right. Thank you so much, Matt. This was great. Did you used to work at Straight Talk?
Yes, I recognize you.
I recognize you. Know him. So yeah, it's so great to see you. This is really good.
To see you too.
So I work at Irvine Valley College, and so I'm sorry to ask. I have like two questions, just because I've been doing this like Cerritos and then here for like 10 years, and so CAT is sadly just a big part of what we do here for the students. What I want to know is, when we call CAT, we do have campus police. So when we call, and now I'm glad we're actually putting together a whole new like crisis protocol for like faculty if they need a call, or anybody. So I'm glad I have the OC Links number, because we did have the other number. When we call, if we're not concerned like safety where police would be needed, I feel like sometimes it's kind of gone back and forth. Like sometimes they're like, yes, we want the police there, because they are on our campus. Is that something we just need to kind of mention, and they can, after we tell them the situation, they can say, yes, we want the police, or no, we don't? Or is that something that we should always be having?
The goal, and part of the goal of the mobile crisis benefit, is to reduce the utilization of law enforcement for evaluations that really don't need that law enforcement presence. I mean, that's really one of the things that we also see in the research too, is that people tend to do, in certain populations, do better when there's not a law enforcement response as well, because that can be pretty intimidating for individuals, especially those that might have had some run-ins with the law when they were younger, or recently. It creates a level of anxiety that isn't helpful to that crisis situation. So with that, I think it's the more information you can report in terms of safety and protective factors in terms of the situation, that's always really helpful. But we're also going to be introducing a new questionnaire too as part of the mobile crisis benefit. It's kind of a decision tool to help us determine within our thresholds of if we're going to need law enforcement or not. So when calling into OC Links, in the near future, there's going to be a series of questions around safety. I think it's about 8 questions, and we're kind of piloting it, so it's going to be kind of it's still new to us, and we have some lessons to learn, I'm sure. But it's going to help us have a more standardized way to determine if law enforcement presence is needed or not, based on that tool.
Okay, and so if because a lot of times, like, we have a counselor, right, academic counselor or professor, they would call CAT because they got an email or they spoke to the student on the phone. So same thing goes for them. So when they call, they'll explain everything, and then you guys will decide if you know, because it wouldn't be, if I'm here, you guys would be coming here, but if it's to the house, you guys would decide, because I know that's a different situation as to whether or not law enforcement would be needed.
Correct. Yeah,
Okay.
that's a determination from that call.
And then my second question, because I know you mentioned Be Well, so we've definitely been introduced to Be Well, and we are in Irvine, so I know they, they work with us here. We have had them come out. Since we're coming up with a new protocol for everybody, is it, because I know CAT can take a while sometimes, just kind of depending on what's going on. If we know it's voluntary, so we know someone's like open to going, but we need them assessed, would we say, okay, we can call, like we do the non-emergency line for Be Well, and then they can take them in the blue van. And then if we know it's going to be involuntary, like that would be CAT, or would you suggest, I don't know, if like wait times are, because I know sometimes it could take a while. And so that was kind of where we were deciding if we were if we knew, and that's a judgment call based on us as clinicians. But I didn't know your thoughts on that with work. I mean, because you did mention Be Well, so it sounds like you guys kind of work with them sometimes.
So yeah, so that's always a challenge that people come across, absolutely, because the CAT team is designated, so we have the ability to make that determination if hospitalization is needed, and that's that legal status hold, as you know. And the Mind-OC vans that they have through Be Well, is those staff are not designated staff, so they don't have the ability to hospitalize if there was that need. So they would have to end up calling our crisis assessment team. So they provide a great service, in helping to de-escalate things or go out and be a part of those conversations if somebody's having a challenge. But if it's a true crisis event, and there's definitely that concern, I recommend calling the CAT team, because if that higher level of care is needed and that determination is needed, our staff have that training and that support to really make that detailed decision in that moment. And our hope too, with the change with the mobile crisis benefit, is really that our response times are going to get better. I'm sure you've heard us say that before, but we do understand that there's those times where it can take longer than we'd like.
Yeah.
But given that we're going to have the ability to transport the increased team support, our hope is that it is going to really help us get into the community more, and really be there in a quicker response time. Because not only are we getting the vehicles, but we're also outfitting them to ensure that the staff have the ability to do the things they need to do within the vehicle. So if you're familiar with our CAT team at all, they tend to come out with a packet of papers about this thick. So they have every resource available that they can provide the handouts. But in our new vehicles, we're looking at having mobile printers. We're going to have workstations in them. So it's really going to eliminate some of that. Oh, I don't have that. Let me go back to the office, or let me find this other thing, and really take out some of those things in the day-to-day that we can improve on, and increase our response. And then also back to the EMS question, because I know like during COVID, we were talking wait times would be 8 or 9 hours for ambulance response. And so as we're more strategically using them for those calls that are appropriate for that, and we have the ability to transport, it'll free up our teams sooner than having to stay on scene waiting for transportation.
So would you say, because that sometimes it isn't CAT, I know that, like I used to wait and I'd be like 3 to 4 hours in the police and it's like 8 p.m. So would they, if you're not sure, they would sometimes just come in that van or with all of that, and then, or is it just depend on the call as to whether or not they take that vehicle or not?
So we're getting the vehicles, and the design is so that each team will have a vehicle, because we're going to be pairing up. So each team will be driving throughout the county in the county vehicle, and so they should be showing up in that vehicle. And but the decision making really comes down to is what level of transportation is appropriate, right? If somebody is actively violent, things like that, or if they just need the level of restraints in an EMS vehicle, sometimes the police might have to take them if they've hurt someone, or if they're really a danger to themselves, which is obviously not our desired response. But
okay, yeah. We're usually on the first end, luckily. So this is very exciting. So I mean, we definitely appreciate that. So you said by the end of the year, so starting like January, this would be going into effect.
Yes.
Okay.
So it will be going to effect in limited capacity, because as we're ramping up, we're trying to get a lot of positions to support this, because as I mentioned, we have teams of 1 right now, and it'll be teams of 2. So, But given some of the exclusionary criteria as well, not being able to go into hospitals, that, things like that, it is going to increase our ability to support within the community.
Okay, thank you so much. I really appreciate it.
Yeah.
Those questions, Stacy. So then Matthew, Michelle had a couple of questions. So she was wondering first, she was curious if you had any families call related to screen addiction mental illness. And I suppose that can apply both to the CAT team, to OC Links, to any of the services that you're representing. And then the follow-up question, are you partnered with 211 to direct those below 24 to your organization for crisis response? So help me if I'm understanding the question correctly, Michelle, but the question is, are they connected with 211 so that if somebody's calling into 211 seeking support or clarification or services, that one of the pathways they might be directed from 211 is to the services that Matthew's talking about, things like OC Links and the CAT team?
Yeah, I was just thinking response times too. I have some friends who are volunteers with 211, and I just became a CERT. So I'm learning more about the emergency response and how our citizens can all play a role. And when I hear something like what Stacy just shared, a 3 or 4 hour response time, that's like too late. So I know there are other orgs doing similar things, but not as specific as you, and maybe not as mobilized. So I was just curious if you might partner to speed up the response times.
Yeah, so OC Links actually does a lot of collaboration with 211, the NAMI warm line, as well as the 988 line. And so there's a lot of call transfers and conversations back and forth to help get those supports. One of the requirements that I don't think I mentioned on the mobile crisis benefit is a 60-minute response requirement from the time that it's been determined that a response is needed, that there's a crisis event. So the screening tool that I mentioned earlier has the safety questions, but also the determination questions. And so once we've completed that initial screening, we've made a determination, our OC Links navigators have made a determination on where someone should go. And then from there, we have 60 minutes to respond to meet the state mandate. So this is it's going to be a big shift, a heavy lift on our end. Hopefully it'll only have positive impacts for those in the community that are using the service. But I think we're definitely moving in the right direction with this new change from the state.
And I asked about the screen addiction. So in more of our interviews, we're finding a lot of youth, especially in college, are so overwhelmed with the screen dependency. And it's, they're lonely in their homes, they're isolating more. I mean, there's almost more isolation than COVID time with the screens. But the great news that 33 states are suing Meta right now for knowing they were creating mental illness in our youth. So that's, I think, a real forward stride that we're able to admit that technology is also a substance and that it actually increases substance abuse of other substances when combined. So I was just curious if since it takes the dopamine up and down like meth does, have you ever dealt with a family calling yet saying like, I can't help my child with screen dependency? I was just curious.
That's a great question. I'd have to look into that a little bit more. I mean, I know we do a lot of education with families on that when we're dealing with them, and a lot of times that conversation is also the other side of it too, because there's a lot of times families will just be like, I'm taking everything away from you, and it's taking away the connections and support for a youth as well. So it's kind of, there's two sides to that coin. There's the overutilization and then the deprivation of it, right? And there's social networks. And we don't want to do that. So I would have to look into that with our team to get some numbers on what those call requests have been for. We're getting about 1,000 calls a week at this time. Wow. Through the OC Links line. So we definitely are serving a lot, getting a lot of inquiries into all the various services. So I would have to look into that for you.
Thanks for what you're doing. I'll try to email you offline. I don't want to take up time. Thank you.
Yeah, no, thank you for the question.
Thank you, Michelle. Stacy, we've got about 4 more minutes left for our time with Matthew for our Q&A. Any other questions from you all, from our attendees, for Matthew? And again, feel free to just unmute yourself at this point or add any question to the chat. Well, Okay, I think that sounds like we've got our questions answered. Matthew, thank you. The presentation was really comprehensive. I think it's,
There was a new question that hopped in the chat.
thank
Sorry.
you.
Yeah, I think I see it from Robert, right?
Mhm.
So we're currently watching that and kind of looking at how we're going to respond to the changes with the criteria for uh, hold levels, and specifically regarding like the gravely disabled and those components, as well as the SUD. So we are paying attention to that and looking at trying to figure out how we're going to adjust to that. So I don't have a lot of details for you at this time, Robert. I apologize, but stay tuned and we'll have more for you on that.
Great, great. We'll maybe have some more information, Matthew, when we have you back to talk about the rollout in a few months.
I'll make a note.
There we go. Well, again, thank you, everyone. We'll move into some of our other portions of the meeting now, but Matthew, thank you especially to you. I think this was really helpful. It was a really comprehensive presentation. I certainly was unaware of a lot of the updates and developments and a lot of the ways that things are shifting there at the healthcare agency to help create, I think, a more how would I put it, maybe a more comprehensive web in terms of those services. I think there's a much clearer set of access points now that leads you to a variety of directions, whether somebody's utilizing the OC Navigator website or they're reaching out to OC Links, and those resources are a great starting point to access all of the other services that are available. So I think it was really great for me to hear about that shift. It's also really great to hear about the other services that are available through the county, as well as to hear, I think just afresh for me, about the ways the CAT team works, the ways the CAT team is responding to various needs in the community. Yeah, I think it was a really helpful, comprehensive presentation.
Great. Well, thank you for having me. I really appreciate the opportunity to be here. I also put my contact information in the chat. So if anybody has any future questions or would like a specific presentation, we also can try to work and figure that out with you all as well, in terms of if you need more details about how the law works and how our evaluation process goes, things like that. We're more than happy to be there, or general presentations also. So,
and as always, folks, too, if you a week from now you think of another question and you realize you didn't have Matthew's information, always feel free to reach out to any Connect OC staff, myself, Crystal, Sarah, Vivi, and we will be happy to connect you with Matthew. Thanks,
he knows where to find me. And yeah, Trisha, if you want to reach out to me, that would work just fine, and I can help figure out whatever presentations you need, just to respond to your comment.
Thank you again, Matthew. And so we'll transition now into some of the other segments of our meetings. So the first one is updates from us, from the Connect OC team. And team, remind me, I know we didn't have a lot to update at the moment, but anything at all, Sarah?
No, I just wanted to mention just one thing about that. We had our Vanguard resource fair last week, and just wanted to give some special shout outs to the healthcare agency. The behavioral health advisory board came out, and the office of Katrina Foley even came out to table at this event, and it was so cool to see students really engaging with each of those booths. And yeah, just wanted to give a special shout out to them, because I know they're super busy with all that they do, and they were super cool to hang out with and talk to, and really awesome to see them out in the community. So that was just my one update that I had. So yeah, that's it.
Awesome. Thanks, Sarah. Also, before I forget, we have, as always, a survey that we would love to have you all complete. This offers us feedback in terms of what's working, what's not working in the meeting. It also provides, we are a county contracted service, and so it provides some feedback to the county about what about these services are working, where are they benefiting from you, where can they be improved, that kind of thing. So we would really appreciate it if you would just take a couple minutes, shouldn't take long, to complete that survey. And then, if I'm not forgetting anything else, team, we have partner updates. So as always, we encourage folks to, if you have flyers, anything like that, or any upcoming events, to share them in the chat. But also, this is a time for our partners to go ahead and raise your hand if you've got something you'd like to share, and we'll call on you. We'd love to have you share about the exciting things that your organizations are doing. A big part of our effort in terms of promoting these existing mental health resources here in the county is also promoting the great events and activities that your organizations are doing. So now's your time. You got anything you'd like to share? Yeah, Michelle.
Hey there, I threw it in chat also, but we're doing a kind of a self-care day wellness fair at a big space in Irvine near the airport in Sky Park area. And we're making a third of the space like the outdoors. So we're doing yoga, sound baths out there. It's free for everyone up to 24. And I invite any nonprofits who want to come. We have 5 right now bringing tables. Tables are free. You could bring collateral, giveaways. I've been meaning to invite the Orange County Healthcare Agency. I'll do that today. But if anyone wants to come, we're hoping for a good crowd. We have a dream goal of 300, and we're reaching out to schools and colleges too. So I shared it, a flyer. I can share my nonprofit partner flyer too in chat. But that's Sunday, the 12th of November.
Awesome. Thanks, Michelle.
Of course.
Anything else we've got going on, got coming up? Cassandra.
Hi, thank you for such a wonderful presentation today. That was really, really informative and helpful. I just wanted to share that we at Wellness and Prevention Center in Alcove have free parent support groups in Laguna Niguel on the 2nd and the 4th Wednesdays of each month. And I will send out the flyers again. One is in Spanish, and it is for parents with children, either minor aged or adults with behavioral health concerns. So that can be SUDS, violence, incarceration. And they're just there to support each other. And it's led by a Spanish language leader. And it's just for them to be together. And the next parent support group that we have is for parents with children, adult aged or minors, that identify as being a part of the LGBTQ community. And that group is led in English. And enrollment in these groups, like I said, is completely free of charge. It includes free childcare. And it also includes free case management services. So it is in person in the city of Laguna Niguel, and you would just contact us and we would go ahead and enroll you. So thank you for the opportunity to share.
Cassandra, quickly, is there, do you by chance have a flyer for those?
Yes, I'm just looking through them right now to make sure that I send it out.
And
Thank
feel
you.
free, if you miss it here, feel free to send it to us. Well, and same thing, Michelle, we have your flyers now, but we'll add this information to our events calendar on our website. Thanks. And Lauren.
Hi, good afternoon. Thank you, Lauren Gaidos with the Wellness and Prevention Center. I wanted to ask if anybody would be willing to fill out a survey. We have a new project that we're working on through a grant through the state of California for suicide prevention. And we're looking for folks who are either parents of individuals 0 to 25 or youth themselves 12 to 25 to complete a survey through UCLA to help us gather some information to guide the work of suicide prevention here in Orange County. So if it's okay with you, David, could I share the link in the chat?
Yes, please.
Great, thank you. And that's all. Thank you.
And then Cindy Moore shared some information. She just wanted to share about Thrive Together OC services. So there's a flyer there as well. To check out. I definitely encourage you to check out the programming that Thrive Together's got going. And thank you, Cassandra. I see those flyers as well. Anybody else? And Lauren has shared the link for the survey as well, flyer link for the survey. Well, Anybody else? I say speak now or forever hold your peace, but you can also just email any of us and we'll definitely make sure we get your information out there. All right, well, I think if that's that, then team, stop me if I'm missing anything, if there's anything that I'm forgetting, but I think that pretty much covers it for today. Thank you all again for joining us. Thank you, Matthew, for the presentation. Just want to draw your attention to on the agenda next month's meetings. So because of the November holidays, Thanksgiving and so on, we won't be having a meeting in November. Because of the December holidays, Christmas and so on, we won't be having our December meeting at the end of December the way we normally would. So it won't be the last Friday of December because of the Christmas and New Year's holidays. But what we've done the last couple of years, and what we'll be doing again this year, is having our next meeting mid-December. So we're going to kind of split the difference. So this Friday, December 15th will be our next meeting. So no meeting in November. And our next meeting won't be at the last Friday of December. Will be in the middle of December, Friday, December 15th. It's there on the agenda. We will be sending out a reminder. But if anybody has any questions or you I know you remember a couple of weeks from now, I know the next Connect OC meeting is not the last Friday of the month, but I don't remember when it is. Feel free to email us and we'll make sure we get you that information. But again, next meeting Friday, December 15th. And we'll look forward to having you all.